Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a very interesting episode today. We're going to be talking about thigh lifts. That's right, thigh lifts. That is lifting the thigh. But I found that thigh lifts are a bit tricky because people don't really understand thigh lifts like the way they understand breast dogs. You say breast dog to a layperson, they're like, oh, yeah. That's that thing where you make the breast bigger, right? Yeah. But you say thigh lift, and there's a little bit of confusion. What is a thigh lift? What the hell are you doing for? Why do you need it? Et cetera, et cetera. So I'm really lucky because I love having episodes where we're joined by my patients because they make the show so much more meaningful and so much more useful because they're willing and courageous to share their stories and be on the show. So, Renee, welcome to the show.
Thank you, Dr. Rady Rahban.
All right. So, Renee, where do you live? What city are you in?
I am in the city of Ontario.
Ontario. And how far is Ontario from my office?
It's about an hour drive.
Okay. So semi-local, but not down the street. Okay. So, Renee, your story started in that, and you can correct me, you're 55. When did we do your thigh lift? Roughly. Was it a year ago?
About a year ago.
So let's say you were 54 and
Yes.
you had lost some weight, if I'm not mistaken, right? About, I don't know, 40, 50 pounds, right?
That is correct.
Which right there in and of itself is a big congratulations, right? To lose 40, 50 pounds. Everyone like sitting at home is like, God, I wish I could lose 5. God, I wish. So there's a lot of people that are trying to lose weight, but to actually do it is fantastic. You lost 40, 50 pounds, which is a decent chunk of weight. And as a result, you started to notice some things happening. And one of the things that happened and really bothered you is you had all this extra skin and tissue rubbing inside your thighs, rubbing against each other, right?
Yes.
Right.
Excess amount.
What's that?
Excess amount.
Excess amount. And we'll get into all that in a minute. And as a result of that weight loss and that skin rubbing together, what was the problem that you were experiencing? So tell me the things about your thighs that bothered you. What bothered you?
The appearance, not being able to wear the clothing that I wanted to wear. And when I did wear it, the looks I would get from other individuals because of the amount of excess skin that did hang below the short line. My lack of confidence wanting to wear the shorts because of the reaction I would get. Just all in general, I just didn't like the way it made me feel. I didn't like the way it looked.
Okay, so you've hit on so many topics. Number one is I just didn't like the way it looked. So for those of you who don't know what excess skin in the thigh is, it's basically redundancy like you do in your belly, like you have extra skin in your belly that sort of hangs, except it occurs in the inside of your thigh. Same thing with breasts, same thing with neck skin, et cetera, except this has just happened to accumulate in the inner thigh. So one was I just didn't like the way it looked. And not only did I like the way it looked naked, but I didn't even like the way it looked in clothes. Certain types of skin excesses you can hide. You just hide them. Nobody knows. Nobody knows you're suffering, and you just keep it to yourself. But this skin that you had in your instance was pretty major. You had a lot of it. It was you couldn't even hide it. Like you couldn't wear shorts. You couldn't wear tight anything, right?
Correct.
And
Even I'm sorry, Dr. Roddy.
yeah, go ahead.
But even wearing jeans that were tight, with time, the jean on the inside would get loose and you could see the folds on the jean.
Right. So it was one, the appearance, and two was the function. I mean, unless you have a lot of skin rubbing, unless you have a lot of skin rubbing on the inside of your thighs, you don't understand the impact of just trying to walk, ambulate,
True.
go from your car to your office down the street. So you have this redundancy that's causing friction, warmth, discomfort, etc. So there's the physicality of it aside from the aesthetics of it, right?
Yeah.
And then the last component is the mental aspect, which is probably the underbelly of almost everything that I do, right? Here is this thing. I feel embarrassed. People are looking at me. I don't feel confident. I actually don't want to wear shorts. I don't care it's 100 degrees. I don't feel comfortable. And so as a result of all of that, you kind of become a prisoner to your thighs, right? They dictate your life.
Yes.
Would you say that was
Well
reasonably
said.
accurate?
Yes, very accurate. Well said.
Okay, so here you have all this extra skin in your thighs. And for those of people who I always like to ask people their journey as to how they figured out what the heck to do. So you know there's something wrong because there's all this skin inside your legs. So what do you do? Did you call a friend who's like, hey, remember that thigh lift you had? What did you do?
You know, my journey originally started with thinking exercise was going to take that away. It did not. I just started looking up how to get rid of inner thigh, excess skin on the inner thighs, and wasn't left with an option but to look into removing it.
So why
Um,
didn't that's very good. Very common question, common experience, which is, you know what? I lost all this weight through diet and exercise. Well, God damn it, I'm going to get
mhm,
rid of this skin. God damn it, I'm going to get rid of this loose skin in my arms. God damn it, I'm going to figure out a way to work out to get
mhm.
rid of the skin in my belly. Stop being so lazy, Renee. And it's not the case. You can't get rid of loose skin. As a matter of fact, the more in shape you get, the worse your skin excess condition becomes. It is the exact opposite. So you realize, okay, there's no way around this. I've done enough homework. I got to remove it. And you realized immediately it was called a thigh lift, right?
Yes.
Okay. So then what did you do? What was your journey in that thigh lift? Because I overheard you conversating a little bit how it went. And I want people to understand how the journey goes. You don't just open a computer or open a magazine and poof, there's a thigh lift.
No. Lots of research, looking up different plastic surgeons, looking at their work, looking at the outcome of the patient, their experience. Um, and I found one plastic surgeon that there's not, and mind you, there's not a whole lot of them out there,
That do
that
thigh lifts, right?
do thigh lifts to the extent that I needed to have it done. I found one in Beverly Hills. I called that provider's office, let them know the amount of excess skin that I had and if this was something that they commonly did. Um, they were very honest with me, which I appreciated, and they let me know that they did not do that amount of thigh lift. And they did recommend you.
Okay. Well,
Um,
that's very uncommon and refreshing to hear. You call an office, you say, hey, I have X problem. Can you
mhm,
fix X problem? Are you familiar with X problem? Are you an expert in X problem? And the right answer is, thank you for calling us. No, we don't. And either A, good luck, we wish you the best, or B, we have someone in mind. We do it all the time. If someone calls my office and asks for something that I don't do, I
mhm,
for sure as hell am not going to do it, but we
mhm,
recommend that they continue searching. Or if we know someone that's excellent, we'll often say, hey, you might want to check out. So that's very nice. The reason why you had that struggle is because for breast augmentation, every
mhm.
plastic surgeon does a breast augmentation,
Yes.
right? Tummy tuck. Every plastic surgeon does a tummy tuck. You had a previous abdominoplasty, right?
Yes.
Okay, so why didn't you go to that guy?
Not happy with the outcome.
Right. So you had an abdominoplasty prior to us meeting. You didn't like the outcome. So you couldn't go back to that guy. And when you do your homework, the reason why we're having this podcast is because thigh lifts are uncommon. It's not something that every surgeon will do. And so as a result, it makes it a little bit more challenging. Okay. So then they said, all right, go see this Rahban guy. Good luck. We wish you the best.
Mhm. Yes.
Okay.
So when I called the office, I was nervous. I was scared. Um, but when I called, your staff was so welcoming. And I let them know the amount of surgery that I was going to need to have done. Um, they reassured me that you've done this plenty of times. They let me know I could go onto your website, look at previous pictures. I did that. I really looked into the amount of work that you've done, the outcome as far as the scar, the appearance, and I was impressed, very impressed, and made the appointment, came in to see you, and
And the rest
even
is
more
and the rest is history.
And the rest is history.
Okay.
Rest is history. It was the best decision I ever made.
Well, we're happy that it was so powerful in your life, and we're grateful that you're here sharing so other people can experience. So let's describe what a thigh lift is in general. So when people lose skin, when people lose weight, they gain skin. Doesn't matter if it's in your neck, breast, arms, whatever. In the thighs, it's a bit particular. You lose weight, you gain skin on the inner thighs. People don't tend to get a lot of loose skin on their outer thighs just because of the way the anatomy is. And then so people come in all the time and then they say, "Can you do a thigh lift?" They grab the inside of their thigh and they pull it upwards towards their pubis and say, "See, look how much better that looks." And so the problem is that while that sounds really good, that's generally not the right approach to removing the excess skin. So the excess skin in the thigh can be removed in either of two dimensions. You can do what's called a medial thigh lift, which means the scar or the removal pattern is in the groin. So in your groin, which is like, oh, ideal, perfect. And you can do a medial thigh lift where the scar is vertical, or what we refer to the long scar, which runs down and from the inner pubis towards your knee, like the seam of a pant or a jean. If you notice, a lot of body contouring mimics clothing. If you do a thigh lift and you look at your jeans or your pants, you'll have a seam on the inside and then one that runs along your groin. If you look at your shirts or your jackets, you'll see that the arm has a seam along the inside, and so on and so forth. So it turns out the overwhelming majority of people who need a thigh lift actually need the long scar. And that's a huge mistake that most surgeons make. Patients don't want it. Oh my God, I don't, but you can't remove the skin just going side to side. It just doesn't work. Now, if you have a lot of skin, as in your instance, you need them both. You need up and down and side to side. And is that what we did for you?
Yes, that's exactly what we did.
Right. So we went up and down where we remove the majority of it, and then we go side to side to clean it up as it goes into the groin. So that is very important for you to understand the distinction between medial, short scar, and vertical, long scar, and know that in most instances, most patients need some variation of a long scar. You cannot escape it, not in the thighs. It's seldom the case that you can just pull it into your groin. The reason that is that thigh lifts are anti-gravitational. You take this excess skin, you push it into your groin, you sew it into the crease of your groin, and you go, fantastic. And 6 months later, that scar is where? 2 or 3 centimeters, 2 inches lower than your groin, and you can just see it right along your thigh. And it's very, very unsightly. So, okay, well, we talked, we told you that we can do your thigh lift, and we went ahead and explained that it would be vertical and horizontal, right?
Yes.
So, what were your thoughts originally with the thigh lift in terms of once you heard that you needed to do that was a procedure you needed?
I was nervous, but mostly I was excited because I knew it could get fixed.
Right. It's what it is usually it's exciting in that you come with a problem and you hope there is a solution, particularly in the instance where you thought perhaps there would not be a solution and you'd be stuck with this forever. To know that there is a solution is usually quite exciting. So, okay, what we're going to do is we're going to take a quick break. We'll come back and then let's talk about the reality. We're going to talk about the recovery. We'll talk about the risks. We'll talk about what the impact was in your life. Because there's the part which is, ooh, I really want an X. And then there's the, ooh, wow, that's the recovery. So it's not something you just buy and take home. You have to undergo it and endure it. So we'll take a quick break. We'll come back and then we'll dive into the second half of thigh lifts.
Okay, sounds great.
All right. So we're going to take a quick break, blah, blah, blah. And we're going to jump right back in. So bring your phone back down so you're dead center. You were doing a great job. Nope. Now you got to go the other way. Yeah, because we started that way. And then just make sure you see how you're veering off to the corner of the screen. Right. So just keep it like that. So you're in the middle. You're doing a great job. 5, 4. All right. Welcome back to the second half of Plastic Surgery Uncensored. Renee and I are diving deep into thigh lifts, everything you need to know about the thigh lift. And what we don't do is we want to talk about recovery, because a thigh lift is a little bit unique in that with eyelids and other surgeries like noses and faces, you're not standing on your eyelid. You're not walking with your nose. And it's a structure that you operate on, but then you have to use almost immediately. So it's kind of a bit tricky. So let's start out with recovery. First question everyone notes is, oh my God, that looks so painful. So I tell most patients it's mild to moderate, a few days of discomfort, but it's generally pain-wise, not terrible. Is that a lie? Was your experience terrible? What was your pain threshold for this?
I had no pain.
Nope.
To
Come on
be
now.
honest, I did not have any pain. It felt tender, but no pain. Um, my experience was more on my end, making sure that I didn't do too much moving because I didn't want to ruin what was done.
Right. But from a pain standpoint, I think it's really important for people to understand pain, which is something nobody wants to experience. Pain has a lot to do with how procedures are done, how accurate they're done, and also a lot has to do with the involvement of other structures like muscle and fascia. Even though the thigh lift is a large surgery, and we'll talk about how long it took about 5 hours. How long did your surgery take? About 5 hours, right?
Yes,
5 to
that is
6
true.
hours. It's a long surgery. It doesn't have a lot of pain associated because it's mostly skin and fat and things of that nature. Then we talk about okay, so I had my procedure done and I go home, and do I need help? Or can I just go home by myself into my apartment? So did you find that help was necessary?
Yes, help was necessary.
Yes. What did you need that help for?
I needed the help to go from sitting positions to standing positions. Again, just in reassurance, making sure that I kept everything intact in the healing process. I needed help with using the restroom.
Mhm.
Um, being you couldn't just go sit. You kind of have to do kind of a squat.
Right.
So you needed someone to help hold you up while
Got
you.
it. So we recommend with a thigh lift that you have someone around for a week, because like an abdominoplasty or a tummy tuck, you need someone around to
Yeah.
exactly what Renee described, get you in and out of bed, usher you to the bathroom, take you back. You're hungry. You're not going to get up every 5 seconds and go to the kitchen. The first week, you need help. So do not, if you're contemplating a thigh lift, don't do one of these things where you're going to be a hero and do it by yourself. Definitely don't think you're going to get 2 days of help from a friend and then they're going to bail. You need a solid week of help from someone to be around, exactly as Renee described. When you get to the second week, you're starting to feel a little bit more courageous. You by then will have come into the office. By then we will have opened up all the dressings, looked at you, made sure everything was okay. And the second week, you can be a little bit more free, and likely is you can get up and get around by yourself, albeit gingerly, but definitely you're at that point a little bit safer. So when can I go back to my job? I work at a desk. I'm very convalescent. I don't do a lot. It's administrative. We say 2 weeks. What do you do for a living, Renee?
Nursing.
So you're a nurse. Holy
Yeah.
crap. So you obviously require some physicality. When did you go back to work?
I went back to work about 3.5 weeks.
Got it.
4 weeks.
Okay. So as we say, if the longer you can take for any surgery, the better, obviously. But we tell you that around 2 weeks you can get back to administrative job. Now, if you work for UPS or FedEx or Costco, maybe you need a bit longer. As a nurse, you're up and running around the unit and taking care of patients, so it's going to take longer. The next question is, how long does this procedure take? We tapped on it. It takes about 5 hours, 6 hours. Well, why the hell is that? I heard that it can be done in 2 hours, 3 hours. Well, anything can be done quickly. The reason it takes a long time is because of the sewing, the closure, putting it all back together. It's a lot of operating. And as everyone who listens to my podcast knows, is if I'm the one doing it, it's going to take a long time, as opposed to two people doing it, one on each thigh. You close, you boom, bam, get out. Body contouring. I lost a lot of weight. I took the skin off my arms, my legs, my thighs, my butt. Those are often done in a tag team scenario. A lot of people jump on board. people closing different limbs. I don't do it that way. So if you want it done delicately and more accurately, someone has to sit there and close, and that someone happens to be me, and needs to be done in layers because it's not going to just cut it. If you close the top layer, it's not going to look great. Drains. I use drains. Thighs have a lot of fluid. You're going through lymphatics. There's big vessels and veins, and you're moving. So unlike some surgeries, breast reduction, for example, where I don't use drains, thighs, I always use drains. And drains come out when about 7 to 10 to 14 days. How long was your drain in?
About 7 days.
Right.
It was
So
about a week.
about a week. So it has to do with how much fluid you're generating and how much bleeding, etc. So we talked about that. Let's switch gears to now the risks, because that's the area that I like to focus my podcast predominantly, right? Because when you go online and you look at things, things are always magical, right? Everyone's got amazing stories, beautiful outcomes. No one's having any complications, but that's not the case. That's not true at all, right? You had your previous surgery done that we ended up having to correct. So obviously, you know better than anybody that things don't always go as they tell you.
Correct.
So what are the risks associated with, let's back up here. Did you have any complications?
I did not.
No, you did not. Okay, thank God. So what were the risks that we were worried about? So a common one is something called seroma. The seroma is where clear fluid accumulates in the area that you've operated. And thighs are very at risk for seromas because it's a big area that we operate. There's a lot of veins and vessels that you have to cut through. And then you're walking immediately after surgery. So it's not unheard of, but it can be avoided. The way I avoid seromas is that when I close the wound, I put stitches from the wound down to the muscle and obliterate or close down the space. So that helps keep seromas from happening. The second, and probably the number one concern for people are scars. Heinous, ugly, nasty, thick scars. Because remember, at the end of the day, it's a trade-off, right?
Yes.
You're trading off one insecurity, deformity issue for another issue / insecurity. So imagine you get rid of all this skin, you feel liberated. Oh my God, this is great. And now you have this horrific looking scar extending all the way down the middle of your thigh. That would kind of suck. It would be okay because you now had some freedom in terms of the friction, but it wouldn't be so great. You wouldn't be running around looking for shorts. So how's your scar?
Amazing. This scar, compared to a lot of scars I've seen, not only on myself, but family members, is precise. It's a fine line. It didn't spread open. I'm not left with. I'm just amazed. I'm just amazed on the appearance.
So you are a high risk patient, and I'll tell
Yeah.
you why. You're dark skinned. You're Latina, right?
Yes.
So you're at risk for making a dark scar. Is your scar
Mhm.
dark?
No.
No. You're at risk for separating or wound gapping because it's your thigh and you're walking and you're sitting. So it's under a lot of tension. So if there's a scar that's going to widen, separate, it's not going to be your eyelid. That's for damn sure. It's going to be your thigh. So the fact
Yes.
that your scar is thin is reflective of many, many stitches being placed, holding it together while your body has a chance to heal. As far as comparison, you have the luxury of having another point of scar in your own body. You had a tummy tuck, right?
Yes.
So you have another scar within your own scar. To forget about comparing yourself to online. You can compare it to your own scar, and a tummy tuck
Yeah.
should heal at least twice better than a thigh. So when patients come in, I tell them the scar of the thigh doesn't heal nowhere as good as the scar of a tummy. How is it compared to your own tummy scar that was done before?
It compares. Before my original one.
Yeah, I'm not talking about the one we revised. No. I'm talking about your original scar that you generated.
Yeah. the scar that I had before separated. It was left lumpy and bumpy. And this thigh lift is smooth. It's fine. There's no separation. And I have no problem with wearing shorts with the appearance of the scar that I have.
And remember, you're a year out. So as a dark
Yeah.
skinned Latina, it's going to take at least 18 to 24, sometimes 36 months for that scar to lighten and lighten. And while it won't disappear, become so faint that it's gone. So those are all great reflections and good points. You were referring to the scar that's in your abdomen because we also ended up revising
Yes.
your abdominoplasty scar. So, which is fascinating because the first time it healed poorly,
Yes.
and many times when patients' scars heal poorly, they're told they're poor healers. It's your body, you're dark skinned, you're Latina, blah, blah, blah. So then you just assume, well, shit, I just healed poorly. And then we revised it and it healed beautifully. So then it tells you that no, that was all bullshit. I was being blamed as a patient for shitty outcomes. So now we know for a fact, because we have 2 points of reference, that you can and should heal pretty well, right?
Yeah.
The next risk is asymmetry because you have 2 thighs and they can't be different. One can't be twice as big as the other. One can't be half the size of the other. So it's very hard to do a surgery and get it right. It's extra hard to do the same surgery twice and get it to look the same. So asymmetry, are your thighs, relatively speaking, similar in size?
Now, yes.
Yeah. Well, I know you had a fair amount of asymmetry. One side was much bigger than the other, right?
Yes.
What side was bigger before surgery?
My right side.
Right. Is that uncommon that one side of your thigh is bigger than the other?
No.
No. There's always more skin on one eyelid. One breast is always bigger and saggier than the other. One ear is bigger than the other. So the fact that you were born and you lost skin in an asymmetric way is common, but we should be able to try to make them more symmetrical, as in the case you have. There is an issue or concern of overcorrection, removing way too much skin. That has 2 complications. One is it makes your inner thigh dented. It goes inwards. It becomes bow-legged. So when you have excess, it bulges. When it's done correctly, it's smooth. And when it's overcorrected, it goes in like a dent. If you remove way too much, it pulls apart. It separates, it dehisces. You sit on a toilet and poof, stitch, 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 unravels, right? And we've
Yeah.
already established that your wounds haven't gapped. So we know that that hasn't happened. And the last, I mean, there's many risks, but the last one we worry about is pulmonary embolus, a PE, a blood clot. The blood clot in your leg goes to your lungs then kill you, you drop dead and die. Now, pulmonary embolus is a risk with all surgeries, liver surgery, heart transplant, blah, blah, blah. But when you operate on the lower extremity, on the leg, the risk is higher. It's higher because we're operating on the area where the clot starts. So there are steps that your surgeon should take in order to minimize blood clots and then subsequently an embolism to your lung. One of them is they should be using blood thinner during the time of surgery. Many surgeons don't because they're afraid that you'll bleed. 2 is you should have squeezers or massagers on your legs while you're under anesthesia because you're just laying there doing nothing. And 3rd, and most importantly, is you got to get your ass off the sofa immediately post-operatively. You have to ambulate. Renee, did you want to ambulate after surgery? Was it like, oh, I can't wait?
No, right after surgery, I just wanted to just rest.
Right. And what happened? We told you to do what?
You emphasized that it was important that I had to get up and move to do what I needed to do and also to prevent risks.
Right. We force you because that's our job. We need you to get up the first few days when you're at the highest risk of blood clot to move, and you're not going to want to because you're just had surgery, you're uncomfortable, you're groggy, you're nauseous, you're whatever the hell you are. But you need to move, and that's why we want you to have someone by your side, because that person, that nurse, that friend, that husband, that whomever is going to help you and move you around and get you ambulating so that that risk is less. So those are the main risks that we can discuss. Okay, so the end all of all these procedures is patient satisfaction and outcomes. It's all about quality of life. It's all about, hey, I'm going to do X so that my life is better. Otherwise, you don't have to do X.
Mhm.
You don't have breast cancer. It's not like you had to remove this skin. So let's get into that final chapter, which is I want you to explain how this has impacted your life, and the more specific you can be, and how it impacted your interpersonal life. Are you married?
Mhm. I am. I am married.
Happily married?
Happily married.
Okay, good.
Happily married. Yeah.
So tell me, what's life like now without all that stuff?
Oh my gosh. Um, it's made such a positive impact, not only in my clothing, um, my relationship, not that it was bad, but just personal relationship. Um, being
How
out to,
how come? Everybody knows I like to push people on
yeah,
interpersonal relationships, because the reason why I like to push people on interpersonal relationships is so much of our confidence and
mhm,
self-esteem is linked to the person we love. Right?
yes,
And
yes,
almost always good partners, men and women, tell their loved ones, "You don't need it. I love you anyways." It's seldom an issue with the partner telling you you need it. It's almost always, "I felt uncomfortable, and therefore I didn't like to take my clothes off. I didn't like to turn the lights on. I didn't like." It isn't the husband or the wife or the life
mhm,
partner telling you. So I like to stop for a moment, because that's a huge part of who we are, is this
mhm.
connection to our partner. So how does it impact your interpersonal relationship?
Just as you said, my husband said I didn't need to have anything done. He loved me the way I was, but my lack of confidence in light without clothing was not great. And now I'm confident and in light out of clothing. And I just feel that it's made even a more positive outcome in who I am, my relationship, um, just in general, even in clothing, um, going out to the beach.
Oh, wow, you've
Mhm.
gone to the beach since we've had
I
each other.
have,
That's
yes,
great.
I have.
And what do you
I
know? It's summer. Isn't that
yeah.
amazing? Before, when it was summer and it was time for pools and beaches and shorts, because summer, you live in California.
Uh-huh.
What would you do? Would you dread it? Would you be excited about it? Would you be looking for clothes? What would you do in a normal summer prior to the surgery?
Uh, shorts to the knee,
So long shorts down to your
long
knees.
shorts down to the knee, sandals, and a shirt. That was it. Everyone else was in bathing suits, shorts, and I was in my long shorts. Didn't want to get up out of my chair. Just sat there and only got up to use the restroom or go get what I had to get. Didn't feel good enough to get up and walk around, and now that's not the case. Not the
Just-
case at all.
I mean, just think about that for a moment. I mean, it's we talk about all these other things, but just think about that. It's you're at a pool with your family,
Mhm,
and everyone is involved in fun stuff and
mhm,
playing, and the kids and people are having barbecues, and here you are sitting and you're very conscious of the fact that I can't go anywhere, like somehow I'm
mhm,
have a handcuff to this chair.
mhm.
I mean, that's a very profound feeling
It
to
is.
know that, hey, I don't want to get up, I don't want anyone to see me, and then to have that juxtaposed to, I don't even remember that issue anymore. I just get up and go do whatever I want. Do you wear a bathing suit?
I do.
What
I
the
want to
what are you serious?
You told me when I left that office, you said, live my life to not being, you know, a prisoner in myself anymore. And that's exactly how I feel. I feel that I'm able to get out and do that now. I'm wearing my bathing suit, I'm wearing my shorts. And as you said, you think of the scar, but the scar is, it's almost not there, to be honest. And going back to what you said, I'm Latina, I'm darker skin, and I thought for sure that my lines on the inside of my thigh were going to be visible to everyone, and it's not. It's not. I'm just out there enjoying myself, enjoying my life, and enjoying my family now, because I'm getting up out of that chair and going out and doing the things that I wasn't doing before.
Well, that's amazing. And that's really what
Yeah.
this is about. And
Yeah.
we can talk about thigh lifts, but we can't talk about this part of it without you. So there's two things that I usually say about plastic surgery. The purpose of the plastic surgery is A, to make you a shinier version of yourself. We just buff you up. You're a diamond and we buff it up and you sparkle some more. And the other is to set you free from whatever it is that's trapping you from living your life. And so you got the benefits of both of those.
I
All
did.
right. Well, that's wonderful. What would be the final piece of advice? One piece of advice to someone listening to this podcast. They're in, I don't know, Omaha, they're in Germany, whatever. And they're like, oh shit, this sounds like, I don't know. One piece of advice would you impart to whoever's listening if they're contemplating or thinking they need it?
Invest in yourself. Really take the time to take care of you. Don't put it off. Don't take the time to make excuses. Know that those options are out there for you to feel better about who you are, to feel better about not being a prisoner within yourself. Just live. You'll be able to live. You're going to be happy. You're going to be able to do the things that you thought you couldn't do.
Yeah, that's wonderful. Well, listen, it's been a pleasure having you. Thank you for joining us. I always am grateful when patients come because I think it's very courageous to put yourself out there. But as a result of your sharing, we hope that other people get knowledge and they get encouragement and they get inspired. As always, it's been a fascinating episode of Plastic Surgery Uncensored. We love it if you enjoy the show. We'd love it for you to leave us some comments. Let us know why. Let us know how. And as always, share and subscribe and keep tuning in. So we'll wrap up this episode of Plastic Surgery Uncensored. Until next week, I'm your host, Dr. Rady Rahban.